Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Okay, hi everybody. This is the Smile Sisters podcast.
Today we're going to talk about wisdom teeth.
Yes.
And their effect on crowding.
Yes. So
Right.
a lot of people ask us about that. Why did my lower teeth all of a sudden start overlapping? Is it because my wisdom teeth are coming in? Is it related?
Or people say, oh, when my wisdom teeth came out, I noticed a lot of pressure on my teeth. I noticed my teeth crowding more.
Right. So that's sometimes like an impetus for people to take their wisdom teeth out.
Yes.
And it's usually, I would say, people who are in their mid to late 20s-ish age group. What do you think?
That want to take out their wisdom teeth?
That come with that complaint.
Yeah, I suppose so, yes.
Yeah.
But they'll say, this crowding, maybe I'll point out, you have this crowding and whatever is causing some issues, gum disease, whatnot. And they'll be like, that happened after my wisdom teeth started to come through.
Yes, a lot of people correlate it. And a lot of orthodontists also recommend for wisdom teeth to be removed before you start braces.
Okay, so let's distinguish between those things because sometimes there's different reasons because we don't really know how much wisdom teeth affect the crowding in your lower teeth, correct?
Yeah.
Or really, it's about the lower front teeth that people notice crowding.
Well, the studies that have been done on this are basically non-conclusive. So first of all, we haven't evaluated what happens to the rest of your jaw when your wisdom teeth erupt. The only thing that studies have been done on is the crowding of the front teeth. So
Sure.
we don't know if like the whole jaw is shifting or what else is happening at that time. But as far as the crowding of the lower teeth, there's so many factors that could be causing it that we can't say for sure that it's because of the wisdom teeth only. But wisdom teeth could be a contributing factor.
But certainly people who don't have wisdom teeth also can get crowding.
Exactly.
So there's other factors.
There's other factors, but wisdom teeth could be a contributing factor. So I think that's why a lot of orthodontists just want you to remove them, because why even have that possibility? Like, just remove it so you don't get the crowding if that is one of the factors.
And then orthodontists sometimes want to also move your teeth. Like let's say your upper teeth are more forward or your lower teeth are more forward than they ought to be. And the orthodontist wants to actually like move all of your teeth back in your jaw.
Right.
So not having your wisdom teeth there allows them to move your teeth into that space.
Yeah, they
But
have
if-
more room to.
Right.
Yeah.
So that's one factor for wanting your
For
wisdom
sure.
teeth out as
Yes.
well, especially if you are treating like a kid.
Yeah.
Teenager, and they really are trying to move the teeth back and forth more, right?
Yes,
That's a big factor.
they really need the space. But most times I think like they want it out because it just makes it easier to place the bands and the brackets and
Sure.
all the stuff that has to be like glued onto your teeth. It's just easier if there's one other tooth also to deal with back there.
That's true. You don't want to have to manage another tooth.
Yeah.
And those teeth sometimes are coming out in all kinds of directions.
Yeah.
So sometimes they take them out.
But the biggest reason to take wisdom teeth out that is actually a proven reason
Yes.
that we can, have studied and can show is periodontal disease.
Yes.
So especially with braces, that even makes it even more necessary because now you're getting even more plaque and bacteria and stuff back there. But it has been shown that wisdom teeth, because it's harder to clean and it's harder to access and it's almost impossible to floss, you're way more likely to have gum disease and bone loss, and all the bacteria associated with periodontal disease are way more likely to live in that area than in other healthy parts of your mouth.
Sure. So then it's like a source of infection for your whole mouth.
Exactly. So that is like really the best kind of like studied reason
Sure.
that we can say, yes, you have to remove your wisdom teeth because it can cause like this. But the crowding hasn't been shown for sure that it's caused by wisdom teeth.
But it's definitely like out there in the beliefs of our patients.
Yes, I believe it too. Honestly, I do, because I feel like there's another kind of pressure point coming in.
Sure.
And you know what, it will contribute. Like, it's not gonna make it less crowded, you know.
Yeah, you're adding more teeth in
You're
a space.
adding more teeth in a small space, so
Sure.
something's gonna give, basically.
Right.
Wisdom teeth crowding, not for sure correlation, but a lot of dentists and a lot of patients really do believe it. And this has been like a common belief for over 150 years in the literature that we can review.
So let's talk about like reasons for removing wisdom teeth. I mean, if they are coming in at an angle and pushing against the next tooth in front of them, that can possibly contribute to crowding, that can also contribute to the gum disease you get because
Exactly.
the tooth is stuck. But if you truly have room for your wisdom teeth, and some people do,
Yes.
and it's coming up straight and it's going to be in your mouth just like another one of your molar teeth,
Right.
then it's not going to have that kind of pressure on your front
Exactly.
teeth, and it's not going to give you gum disease. So truly, it's the same reasons for removing it.
Exactly.
You know, if it's coming in crooked and causing gum issues, it may also be causing crowding issues and
Exactly.
pressure in ways that we don't want.
It
So
just comes down to that space
Right.
situation. Like, if you just don't have the space for it, it's going to create all kinds of issues, because you're putting another pretty big tooth in a space where you don't have room for another tooth. So
Right.
it's going to create pressure on the other teeth, gum disease, crowding, all these things that we've been talking about. But the crowding thing is a common belief, but studies don't back it up that this is the only thing that
Right.
causes it. So,
yeah, so take them out if they're impacted, if they're coming in crooked.
Yes.
You know, and those.
if you're gonna get braces and you know you already don't have the space, it's just gonna make it harder to clean. So it's just better to take them out.
Even if you're doing Invisalign, it's helpful because often these kind of half in, half out wisdom teeth, the tray for your Invisalign trays kind of wrap around the back of your last tooth.
Right.
And when you have a wisdom tooth that's half in, half out, often these trays can't wrap around that because it's not there. So they kind of just like leave like this little lip that just sort of covers the top of your wisdom tooth. But then your Invisalign tray can be less effective because it doesn't have that kind of
It can't
360 grip around your
It can't
back
grip
tooth.
the tooth all around because there's another tooth in the way.
Exactly. And so
yeah.
taking them out can sometimes make your Invisalign kind of more effective because
successful.
it has more
Yes,
retention
yes.
around your teeth.
For sure. So overall, the reasons for taking them out are basically the same.
Yeah.
Gum disease, lack of space, damage to the tooth next to it. But the crowding may or may not be caused by the erupting wisdom teeth.
Right.
We just don't know. The evidence doesn't support that this is for sure one of the causes of it.
It doesn't, but a lot of people say
Yeah.
it's there, it puts pressure. So
Yeah.
and we say, okay.
Yeah, I mean,
Sure.
the evidence doesn't say that it's not. It's just that we can't say for sure that it's a cause and effect
sure.
relationship.
So you should
So-
take them out if they're impacted, they're infected, they're causing gum issues, they're pressing against the other teeth in a weird angle.
Yes.
Right?
Yes. So, wisdom teeth questions, please go to LA Dental Clinic. We do free consults. And see you next time.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.